Are you ready for your Medicare Part B premium to jump again? A new leak suggests it could rise to $197 a month starting in 2026. And that's more than just a number. It's a potential hit to your Social Security check and your monthly budget. If you rely on fixed income or already feel the pinch of rising costs, this update could directly affect your financial stability. In this video, we're breaking down what this leaked premium increase really means, how it could impact Social Security beneficiaries like you, and, most importantly, how to get ahead of it. You'll also learn about a free Medicare assistance option that's helping people just like you save money and avoid unexpected financial surprises. Welcome to Financial Area, your trusted source for financial updates, Social Security news, and Medicare insights. If you find this information helpful, make sure to like, subscribe, and share this video so others can stay informed too. The Medicare Part B premium is once again making headlines, and not for good reasons. According to a newly leaked estimate, the monthly premium is expected to rise from $185 to $197 by 2026. That's a $12 jump, or about a 6.5% increase. While it might seem like a modest adjustment on paper, it continues a trend that's been quietly chipping away at retirees' monthly budgets. Just a couple of years ago, in 2024, the premium was $174.70. These gradual hikes may not sound alarming individually, but when viewed over time, they add up quickly and can have a noticeable impact on anyone living on a fixed income. What makes this situation even more important is that it's not an official government announcement yet. However, these types of leaks have often been accurate predictors of what's to come. The fact that such specific numbers are circulating this early suggests that discussions are already well underway behind closed doors. That means beneficiaries need to start paying attention now, before the announcement becomes official and planning time runs out. Whether you're enrolled in Medicare yourself or have loved ones who are, it's critical to understand the ripple effects this kind of increase can have. Every dollar counts, especially for seniors balancing prescription costs, housing, food, and other essentials. A $12 increase per month doesn't just reduce available funds, it shifts priorities, especially for those with already tight margins. This isn't just about policy, it's about real people and real money. As these premiums rise steadily year after year, the gap between what retirees need and what they actually receive grows wider. And for many, it's beginning to feel like a silent squeeze that never lets up. The projected increase in the Medicare Part B premium doesn't just affect the program. It directly impacts around 70 million Americans who are enrolled in Medicare, most of whom also receive Social Security benefits. For retirees, disabled individuals, and those receiving supplemental security income, even small increases in healthcare costs can cause noticeable strain. These are people living on fixed incomes, many of whom are already struggling to make ends meet in an economy where everything from groceries to rent seems to be going up. When Medicare premiums rise, it means a bigger chunk of their Social Security check is automatically taken out before they even see it. For a lot of beneficiaries, that monthly Social Security payment is the only steady income they have. When premiums increase, the net amount they take home each month shrinks. This doesn't just reduce financial flexibility. It can force people to make tough decisions about which bills to pay, which medications to skip, or what basic necessities to go without. And because these premium deductions are automatic, most people don't even have a chance to plan or adjust before the change hits their bank account. What makes matters worse is how little attention these shifts often get in the mainstream conversation. While news may cover inflation or COLA adjustments, there's far less coverage about how Medicare premiums are quietly climbing and offsetting those gains. A cost of living increase in Social Security can feel completely wiped out once you factor in the higher Medicare deductions. It's frustrating for many seniors who were promised stability, only to find that every year brings a new financial challenge. The rising premiums may be calculated as percentages, but for real people, they translate into daily stress and sacrifices. Understanding when these premium changes become official is crucial for planning ahead. Typically, the Centers for Medicare and Medicaid Services, CMS, announces the updated Medicare Part B premium amounts between August and November each year. While that may sound like a distant timeline, the leaked estimate of $197 for 2026 gives early insight into where things might be heading. And that means now is the time to start preparing. Waiting until the official numbers are announced often leaves little room for adjustment, especially when those deductions automatically begin in January. Being proactive can make a significant difference in how well you manage the changes. Many people aren't aware that there are completely free resources available to help them better understand their Medicare options and potentially lower their monthly costs. These services often come in the form of Medicare assistance programs, where licensed advisors review your current plan, assess your eligibility for benefits, and help you explore more cost-effective alternatives. These advisors don't charge you, and they work with programs that are already available to you as a Medicare beneficiary. Whether it's a better supplemental plan, a prescription drug plan that reduces your out-of-pocket costs, or even options that include additional support for things like dental or vision, there's help available, but only if you know where to look. Across the country, many seniors have already saved hundreds of dollars each year by taking the time to sit down with these trusted advisors. Sometimes it's a matter of finding a more efficient plan, and other times it's about correcting a mistake that's been costing them for years. What's important is that you don't assume your current plan is the best or only option. Medicare can be complex and confusing, and without expert help, many beneficiaries miss out on savings that could ease the burden of these premium hikes. These resources aren't just for new enrollees. They're for anyone who wants to make sure they're not overpaying or undercovered. Beyond personal preparation, it's also essential to stay informed and connected to a larger community. Talking to friends and family, sharing information, and encouraging others to review their Medicare options can make a real difference. When we spread awareness, we create a stronger, more informed network of people who are less likely to be blindsided by changes like premium increases. It's about empowering one another and making sure that everyone, especially our most vulnerable seniors, knows they don't have to face these challenges alone. Being informed isn't just a personal advantage, it's a form of advocacy that protects the entire community. The potential rise in Medicare Part B premiums to $197 may not be official yet, but the impact it could have on millions of Social Security beneficiaries is very real. For those living on fixed incomes, every dollar matters, and this kind of increase can tighten already strained budgets. That's why it's so important to stay ahead of the curve, understand what's coming, and take full advantage of the free resources available to help navigate these changes. If you or someone you know depends on Medicare, now is the time to start preparing. Don't wait for the official announcement to take action. Explore your options, speak with a trusted Medicare advisor, and make sure you're not leaving money on the table. Staying informed today can help protect your finances tomorrow. Thanks for watching Financial Area, where we break down the issues that matter most to your wallet and your well-being. If you found this video helpful, make sure to like, subscribe, and share it with others who might benefit. We'll continue bringing you the latest updates so you can stay empowered, prepared, and financially informed.